This passive back bend requires a bench, a foam roller, and if you want, a couple pound, like some 2-pound weights. Try not to go any heavier than that. You're going to place the edge of the foam roller right at the base of your T-spine, so right where your ribs start. If you're having trouble finding that, just be patient. You're here, and then from there, you'll allow your head to drop back. I'm gonna let these rest right in through here, at least for now. At first, I just wanna see how it feels as I explore a little bit of shoulder range of motion. I try to reach on to the back of the foam roller, and then like snow angels, I reach them all the way around again. I pause in a spot that feels pretty good, maybe right about here. Breathe into it. Allow gravity to kind of take you a little. Maybe even shift a little over to one side so you can kind of amplify that stretch in through the bicep and through the anterior delt all the way in through here. And then maybe do that on the other side, leaning over a little bit more. Whew. Come back in through to center, and if you want a little bit more, you're gonna grab onto 2.5-pound plates, and then you're gonna bring them out like they're flies. From there, you'll find that same kind of snow angel motion where you bring it all the way down, you let gravity in the weights, lower and lower and lower your hands, and in doing so, stretch a little bit more across your pecs. If you do decide to reach your arms up over your head, make sure that your shoulders are rooted down and that you're not lifting up. So shoulders rooted, elbows extended. Right in through here and all the way. Whew, pausing in spots along the way if it feels good. After about 90 seconds here, you'll drop the weights, you'll reach up and over your head, and you'll try to grab onto the very end of the foam roller. From there, I take inhales, and on my exhale, I get some core work in. I work on trying to take those flared ribs and pulling them down and increasing my extension in through my spine. If I want, I can also kind of lower down a little, find a different spot, inhale, and exhale. About 5 minutes total exploring this very passive back bend. All right, we're gonna be focusing on the triceps. You're gonna give yourself a deep tissue massage. So you're gonna start right at where the tricep kind of inserts in and bring yourself right about here. Make sure to show everyone your muscles. And then from there, you're just gonna kind of rock forward and back. I like to work against the grain of the tissue. I gotta tell you, I was really excited to do this so I can inflict some pain on my brother. And you're just gonna breathe, yeah. So that's the only thing you focus on. And we hang out a lot into the insertion points. We find that musculature is the tightest as where it inserts or where it connects. So we're gonna focus a lot of energy and attention on that. And now notice that Sean's in a flex position, right? His elbow is bent. Now go ahead, take an inhale for me. And then on your exhale, I am going to extend you and then roll you side to side there, right? Your life just got a little bit more exciting. And then inhale, release. And exhale, extend. And rock it side to side. Now go ahead and move down just about a centimeter or so. Inhale. And exhale. Rocking it side to side. So you're bringing it in and out, a flexion and extension, right? We're in extension now, and now flex, and then extend. side. I love that you have no pain face. You refuse to acknowledge how painful this is. Inhale for me. And exhale, over and back. We're going to move down just a little bit, right about there. Inhale. And exhale, side to side. I'm getting closer, I'm getting closer. And then again, I'm moving down a centimeter. Inhale. Awesome, I'm getting there, you're afraid. Inhale. And exhale. As I get closer and closer into the elbow, right where that tricep inserts. This is going to be really good if you ever get elbow tendonitis. If you feel a lot of kind of inflammation surrounding the joint of the elbow, a lot of times that tricep is pulling on the elbow. And then one right where it's going to hurt, right about there. Inhale. And exhale. No pain. No pain. Good. From there, we didn't do it for the 2 minutes as prescribed, but just go ahead, reach your arms up over your head. Right arm, left arm, boom, pull over to the side for me. Good. As we all can see, this ability to get your, the ability to roll your shoulder down your back and get your bicep in line with your ear is now improved. Nice job. Was it worth the pain?
It was worth it.
Okay. It's not on your hip, it's not on your sacrum, but right in that open jiggly space. We'll hang out in through there, and then at first, just survey the area. Especially if this is the first time that you've ever kind of explored your backside in this way. Just be patient, make sure that you're breathing, and then eventually we can explore some range of motion. That would be bringing the knee into the chest and then fully extending it. And what I'm really trying to do is access the deepest butt muscle that I have, which is my piriformis. Technically, it is the muscle that attaches the femur into the hip, so that leg bone into the hip. You're going to try to find that femur and to try to find that piriformis, and boom, I think I found it. And then once I do, I'm going to take that right ankle, I'm going to place it on top of my left thigh as if I'm doing a thread the needle. So now it's like adding a yogi stretch with a little bit of deep tissue mashing for maximum efficiency. We're rocking side to side, up and back, ooh, to and fro, right in through here. And then you're going to come onto the side of the hip. So I roll on over to the side of the hip, and I bring the knee in, so now I'm still on the glutes, but I'm a little bit more kind of on that TFL, so that lateral hip flexor muscle, and now I can access both the front, so one ball is on my TFL and one ball is still on my glutes. I can use range of motion, extension, flexion, and then rocking it down, down, down until we can get into the hamstrings. So right now, I'm right where my booty inserts to my hamstring. I'm going to hang out and through here, and then I'm going to windshield wiper the foot from side to side. Now, if you're not flexible enough to get into this position, you can hang out here, or you can grab onto something like a bench or something to keep you upright.